So Lesotho is due to receive its share of the COVID-19 vaccine. It's estimated that about 400,000 doses will be made available in that country. SABC News correspondent in Maseru, Rapelang Radebe, joins me now live. A very good evening to you, Rapelang. Thanks indeed for your time. So the latest I'm hearing now is that the vaccine has arrived in the country, and to receive it was the Prime Minister of the country as well as the Health Minister. Has that indeed been the case?
Yes, indeed, Griselda. Thank you very much. I think if you can see quite an activity behind me here, this is when they reach the end of about an hour or so program, where they have now received 36,000 that has been arranged of the AstraZeneca, still crippling with that name, but mostly I think this is what has been organized through UNICEF. It is the first batch of what is anticipated as the 400,000 deaths you've mentioned. But this is just the first batch that we say it will do and go a long way to help us with at least meeting out the health professionals.
What has been the general sense from locals there now that the vaccine has arrived?
There's mixed feelings, mostly saying it is probably not enough. There has been some who has actually been saying critical about it and saying, did the country Lesotho really have what we call a pandemic to an extent of the measures that has been taken? Some were doubting that probably the measures were extreme, not equal to the level, because, we're still just below 300 in terms of deaths. Yeah. There has been at least around 60,000 confirmed cases. So it's mixed feelings. But as it arrived, we saw even the preachers come in to lay hands on it, praying for it, saying it is a welcome relief.
All right, so what's going to be the process now? Who will be amongst the first to be vaccinated?
We have been introduced to a team of professionals that we say will be there to guide. As you will understand that AstraZeneca was one of the most critical as to whether the efficacy will actually meet the strain that is currently prevalent in Lesotho. So those professionals are the ones who will actually be going through the protocols as to who qualifies for that particular vaccine and how it will be mitigated. But also the Prime Minister, I think, was relieved, saying he has been on the lockdown, opening up, closing up, opening up, closing up, and he says he hopes this will be a step towards a normal economy as things begin to standardize.
And I want to talk a bit about the AstraZeneca vaccine. I mean, talk us through the decision by Lesotho to have that vaccine, especially in light of, I guess, questions that were raised here in South Africa. Of course, the WHO had dealt with that much after South Africa had taken those decisions, in particular in light as well of the close proximity of these two countries.
Exactly. You're absolutely right, because we know that the strain will probably most likely be the one that is existing in South Africa in terms of existence. But there has been an insistence that these are some of the decisions that were made some time back, and Lesotho being not a very rich country, if one must say, they had made preparations way in time. So what they are insisting is that the resources, or the one that is available, what they will do is they will target who is most suitable for it, and this is how it will be distributed. We have heard that from the WHO, that it is not that it is redundant in terms of efficacy, but you need to target people who are most vulnerable, and the same vaccine is equally appropriate to be used.
I understand that the Prime Minister was there to receive it together with the Health Minister. Any words, I guess, from the Health Minister of that country about how this will go a long way in ensuring that Lesotho is amongst those countries that will be able to successfully deal with the spread of this COVID-19?
Absolutely, you are right. The Health Minister, relatively new, arriving in the ministry, he said this is the beginning of a new chapter. Right. But one must mention, if you can see that we still have a problem where the health professionals, close to 300 to 400 nurses, are still not going back to their posts because of the divisions, because of the misunderstanding of the salaries and their incomes that they are saying the Ministry of Health has not actually fulfilled their promises. Some of them not receiving their stipends or the coronavirus money that was due to them. So the question is whether is this not going to be compromising the actual distribution of the virus? This is some of the questions that will be going to the minister to answer as to how smooth when these nurses and the health professionals are compromised and are still on strike, if one may call it so.
All right, thank you very much indeed, SABC News correspondent Rapelang Radebe in Maseru. On the latest there, the vaccine arriving in that country, and the health minister there in that particular country saying this is the start of dealing or fighting against COVID-19. And coming up just after the break, the public accounts watchdog Scopa is set to get a briefing on the progress in the business rescue of SAA and also get an update on